why? The majority of Americans now think marijuana should be legal, and that majority is growing. According to this recent Pew poll, check it out. By the way, back in 1969, just 12% favored legalization. In 2000, it bumped up to 31%, and now you see the number on the bottom of your screen. 53% of Americans say marijuana should be legal. Our own Dr. Sanjay Gupta has been investigating medical marijuana for 3 years. WEED3, the marijuana revolution, introduces a San Francisco doctor who shows Sanjay something he had never thought he would ever see: a patient using marijuana right in the hospital room. Watch this.
It's unique, it's different. I never thought I would be smoking weed in the hospital.
This is San Francisco General, an academic teaching hospital that, because of Dr. Abrams, has a stash of marijuana in their pharmacy. It is stored next to all the other medications.
Get ready.
And Abrams is using it to see if it can relieve chronic pain in patients with a rare blood disorder.
Hold it.
Janelle Lachose is a painter. She was also born with sickle cell anemia and has been in pain for as long as she can remember.
You can exhale now.
She says marijuana makes her nearly pain-free.
How long after you smoke do you start to have some sort of relief of your pain?
Instantly. It's like instantly.
Within minutes?
Yeah, a couple minutes afterwards, you feel the relief of pain.
Joining me now, Dr. Sanjay Gupta, our CNN chief medical correspondent. I mean, that's something you never thought you'd see, right? Marijuana in a hospital. I mean, this is pretty stunning stuff. You've been working on this for a while. How important is this study?
Well, you know, first of all, you're right. I mean, we saw this in Jerusalem a few years ago, where they've been doing this for some time in the hospital, allowing patients to take in cannabis for all sorts of different things. I didn't think I'd see it in this country, but the pain, control issue is such a problem. You know, 80% of the world's pain medications are consumed in the United States, Brooke. 80% of the world's pain medications. We are 5% of the world's population, 80% of the world's pain meds. And now overdose from those medications is the #1 cause of preventable death in this country. Just think about that. It's staggering. Meds are doing this to us. So the idea that marijuana, that cannabis, could be used as an effective form of pain relief, studied in an academic hospital to make sure you know how to use it, how to dose it, all those sorts of things, but could greatly reduce overdose deaths. We could not find a documented case of someone dying of an overdose from marijuana. So I think this is potentially a very big deal.
You know, we've talked over the last couple of years as you've been working on this, and you've said, you know, there's this really lack of research in this field. How far has it come?
Yeah, well, you know, I think there's a sort of revolution happening, Brooke. You know, I've been writing about this for some time, but, you know, there have been more federally approved studies now in the last 12 months than there were in the previous 12 years.
Wow.
Just gives you an idea. Most of the studies that were approved in the past even were designed to look at harm. Very few designed to look at benefit. I think you're seeing a change. You know, mainstream academic scientists who wouldn't even dip a toe into this area now plunging in head first to try and research this. The farm that you're looking at there, they increased their production 30-fold just over the last year in anticipation of all these studies. So something is happening. And everybody's always wanted to have the data, the facts, the science, the research. That's starting to happen as well.
I know you, though, also address the skeptics. You know, I can just hear people, I just talked to someone today saying, listen, marijuana is this gateway drug. What's your response to all of that?
Well, you know, when we first did the first doc, you know, I'll tell you, Brooke, it was a bit of a lonely place to be out there, you know, a few years ago reporting on this. You know, government officials wouldn't talk to us. Patients were reluctant to talk to us. There was a lot of skepticism. I can tell you now, things have changed a lot. I mean, we are able to get incredible access to the beginning now of federally funded studies. We've talked to senators, talked to the President of the United States about this, all the government agencies, patients. So, you know, I think there's still a fair amount of skepticism out there, but I think it's definitely changing. And I think, look, Brooke, the idea has been that so much of this research is going on in other parts of the world. The United States, for whatever reason, has been really behind in this area. It's not all going to pan out. Hardly any study is guaranteed to pan out. But there are things in there that are likely to be beneficial to people. And the people who are using it now in these studies are using it because nothing else that's been offered to them has worked. and this is one of their last options. So, yeah, I think the mood is changing, and I think for good reason.
I can't wait to see this. I've heard so much about it. WEED3, the Marijuana Revolution, Sunday night, 9 o'clock Eastern and Pacific, and it's followed by CNN original series High Profits, the story of the first ever moguls of marijuana. The series premieres Sunday night, 10 o'clock Eastern and Pacific. Dr. Gupta, thank you so much, and we will be